Hey everyone, Ryan here, and welcome back to our head and neck anatomy series. This video will be on craniofacial lymphatics, and it'll actually be the final content learning video of this series. We will have a bonus video coming up very soon that'll contain practice questions to test what you've learned throughout this series. We'll have both classic style multiple choice as well as case type questions designed specifically for the integrated board exam. So again, stay tuned for that video coming very soon. So the lymphatic system is designed to help rid the body of toxins and waste, and it does so with this medium called lymph. A lymph is a clear, colorless fluid that contains white blood cells to help fight infection. Now, it usually passes through at least one set of nodes, here's a lymph node, before it empties into the venous system. Many lymphatic vessels will contain valves that help direct the flow of lymph, because unlike the circulatory system, which has a pump, which is the heart, the lymphatic system does not have that. So it widely depends on valvular direction, as well as the contraction of surrounding muscles and respiratory movements that can help propel the lymph through these vessels in one direction. The tonsils, adenoids, spleen, and thymus are also all part of this lymphatic system. The superficial cervical nodes form a ring around the base of the head and drain lymph from the face and the scalp. So there are a couple of nodes to keep in mind: the occipital nodes. We have the posterior auricular nodes, also known as the mastoid nodes, the parotid nodes, the submandibular nodes, as well as the submental nodes. And so all of these together, we have just the ones on the right side of the head labeled. There are also these 5 pairings on the left side. And so all of those together form a ring around the base of the head. The direction of lymphatic drainage is going to be from the center of the face off to the side. So all of these lymph nodes will get lymph poured into them, and then they will drain into the deep cervical nodes located here. So the deep cervical nodes are important because they're receiving all of that drainage from the face. And this will be the last time I bring this up, this high yield fact of the carotid sheath. So remember, just one last time, the carotid sheath surrounds 4 things: the common carotid artery, the internal jugular vein, the vagus nerve, and the deep cervical lymph nodes, and that's where these come in. So on both sides of the neck, these lymph nodes are right next to that internal jugular vein. The deep cervical nodes along the right internal jugular vein empty into the right lymphatic duct. The deep cervical nodes along the left internal jugular vein empty into the thoracic duct. So there's not a left lymphatic duct, it's just a thoracic duct. And both of these ducts empty into the venous system near the junction of their respective subclavian and internal jugular veins. Now, one other fun fact is that the right lymphatic duct is only responsible for this upper right quadrant of the body, whereas the thoracic duct takes care of draining the other 3/4 of the body. So it does quite a bit more work. All right, so that's it for this short video. Thank you so much for watching, everyone. Please like this video if you enjoyed it, and subscribe to this channel for more on dentistry. If you're interested in supporting me and what I do, please check out my Patreon page. Thank you to all of my patrons here for their support. You can unlock extras like access to my video slides to take notes on and practice questions for the board exams. So go check that out. The link is in the description. Thanks again for watching, everyone. I'll see you in the practice questions video.